Hey guys, I'm Dr. Ellie and I'm here with my podcast, I Heal Kids. And if you don't know me, I'm in Asheville, North Carolina, and I see kids 0 to 21 for holistic pediatrics. So if you need any of that, definitely reach out. And I also see kiddos ages 2 to 102 for functional medicine, which if you do not know what that is, go back and see my other podcast all about it. I will link those in the show notes. And today I'm super stoked. I'm here with Dr. Jennifer Conte. Welcome.
Thank you.
And Dr. Jennifer Conti received both her master's and her doctorate, if I can speak, in acupuncture and Chinese medicine from the Taoist Traditions College of Chinese Medical Arts in Asheville, which is like a huge mouthful and also amazing. And she studied under the lineage of Master Jeffrey Yuan. That's awesome. I'm going to ask you about that later. So after graduation, she actually moved to Colorado for a minute where she studied at Denver's premier Eastern Medicine Clinic for kids and families, which is why we're talking to you today. And Dr. Jen has completed postgraduate studies in pediatrics, guys. I mean, that is not common. Gynecology for all of y'all women or people who identify, and gastroenterology, and currently holds an international certification in pediatric acupuncture. And she came back to Asheville, thank goodness, and she owns Sacred Lines Family Acupuncture here in Asheville with her husband. Thank you so much. I'm so excited to talk to you today.
Yeah, thank you so much for having me.
So I want to start with your story a little bit. So kind of like what drew you to acupuncture, Chinese medicine? How did your journey lead you from Taoist traditions? What is Taoist traditions? Here in Asheville, all the way to opening up Sacred Lines Family Acupuncture with your husband.
Yeah, so like many acupuncturists, the story usually begins with seeking out Chinese medicine for something you've had going on long term, things that maybe never really got quite resolved, and seeking out other therapies. So that's kind of how my story begins with Chinese medicine. Before I was an acupuncturist, I was a massage therapist for a number of years. And my massage therapy school was also unique in that it had an acupuncture school. So I had the ability to receive acupuncture from the student clinic there. And it was kind of one of those things where I was like, why not? What do I have to lose in trying this? So most of my life, I've experienced really horrendous digestive issues as well as menstrual issues. So I never really got them fully resolved in all the things that I had tried. So again, it was one of those things like, I might as well give this a try. So I worked with many of the student clinic acupuncturists there for several months. And, I had a really profound experience in that not only did it resolve these issues that I'd been dealing with for a very long time, but it also kind of allowed me to have this connection to myself and my body that I really had never experienced. It was just so kind of eye-opening, something like the first time you're seeing things in color. That was kind of the experience I had. So it was definitely one of these things in the back of my mind because of my experience that I had with acupuncture and Chinese medicine, that I knew at some point in life that's what I wanted to ultimately do, to help people and allow people to experience the same things that I had experienced from the medicine.
Yeah, I feel like it's so common for holistic practitioners of any kind to just be like, okay, I'm not getting anywhere with Western medicine, or I am, but it's not like fully resolved, or maybe there's more to it that I don't know about or want to explore. I've had a lot of issues, autoimmune and digestive and all of those, and that's how I ended up in the functional medicine world. And it's pretty amazing that kind of those stories that are like a little bit uncomfortable or a little bit like not so fun to go through lead to so many amazing practitioners because we're just so empathic. We understand like what it's like to go through the journey, and we're just so able to be there for people. I'm curious about Master Jeffrey Yuan. So this is such a unique path. What about like that lineage specifically, or like the school of Taoist traditions, all of that, like how does that shape how you practice when you see kids and families? I know you did the training in Denver too, so maybe a little bit about that as well.
Yeah. So the school here in Asheville is a very different school than most of the Chinese medicine schools in the United States, in that it teaches Chinese medicine more like an art form. It's not necessarily, you have this condition and here are these acupuncture points that treat this as a protocol. It's more of utilizing your knowledge and intuition in making this an art form when you treat patients. Additionally, the school teaches other kind of what we call complementary channels that most schools don't get. So the cool thing about it is I learned to look at things through many lenses as opposed to just kind of the 12 primary channels that most schools teach. I learned other complementary channels that deal with other things. So you learn this ability to treat things from all these different levels that a lot of people don't get.
That's amazing. And so, from the very little that I understand about Chinese medicine, which really just comes from me seeing a Chinese medicine practitioner. So, please correct me if I'm wrong. But the channels you're talking about, are these like the meridian channels or is this something different? Okay. And so,
Yes.
for people that don't know, what in the world is that?
Right. So the meridian channels are basically energetic channels that run along the body, and that's where the acupuncture points are placed. So there are 12 primary meridian channels, meaning there are 12 channels that we use that have acupuncture points on them to treat a particular condition. So additionally, I learned those 12, but I also learned these other complementary channels that kind of stem off of those to treat,
Okay.
yeah, to treat kind of more in-depth things in a sense.
Oh, that's amazing. So, like, not only did you learn like the basic part, but you also have like this other training where you could get a little bit more like nuanced and really get in there. Okay,
Yes.
I see. So I feel like a lot of parents and patients, let's be honest. I mean, they're picturing tiny needles and we're all kind of freaking out because we hear pediatric acupuncture and we're like, there is no way that my kid or this patient is going to sit through needles being put into them. So I was just hoping you could kind of talk through that. Like, do you use non needle techniques? How do the needle techniques go with young kids? Do you use both when treating kids? Like, how does it work? Because I know that this is a big question that people have is like, is my kid going to be like screaming in the office and running out the door and freaking out?
Yes, it's the number one question I get anytime I talk to parents and the public in general. So, I do use both needles and non needles on kids. I'll kind of elaborate what non needle techniques I use. But to start with the needle portion, we have very specific needles that we use with kids. So, they are teeny, teeny, teeny tiny. They are basically the same size as one strand of hair. They're also silicone coated, and what that means is it's meant not to be painful. A lot of adult needles are not silicone coated, and there's a reason for that. But with kids, you can use silicone coated needles. So it makes them kind of less sensitive, I would say, in that respect. But I was very specifically trained on how to work with kids, especially with kids that have a needle phobia. I do kind of show them the needle. I show them what it looks like. I take the scariness out of it. I demonstrate it on myself. Sometimes they'll ask the parent to do it as well. So sometimes the parent's also willing to try the needle. And I would say, crazy as it sounds, 9 times out of 10, they're curious enough about it to try it.
Yeah.
The other thing is, for the first time, we try the needle in a place where I absolutely know it's not going to be painful. Obviously, there's more sensitive areas on the body, like the hands and feet. That is not a place I'm going to start with. We
Hmm.
really are going to start with a place where it's not going to be scary. It's not going to be painful. And over time, we build up to those more sensitive areas as they get used to the needles. It's also one of those things where you kinda have to try it, like, you really don't know what it's like until you try it. But
Yeah.
I really try to build rapport with kids, and we work together as a team. Nobody has to do anything they don't wanna do, and we really do try to take the scariness out of it. And the cool thing is, over time, once they get used to needles, they do have the ability to lay there for a few minutes with the needles and relax. It's really one of the coolest things I've experienced in being an acupuncturist is to see a kid chill out with some needles and so as far as do I use both? Yes. It always depends on what's going on. Sometimes I feel like maybe 1 or 0 needles is appropriate for the condition I'm treating. Sometimes diet and lifestyle and herbal medicine might be something more that I think is going to have a stronger effect for what's going on. So it's always tailored to what I think is most appropriate for the child and what's going on. So, as far as non needle techniques, I have all kinds of other tools. We do massage, I do cupping, I have laser lights, I use moxibustion, which is a warming technique with an herb, herbal medicine, diet and lifestyle, meditation. We have lots of other tools that we use in addition to needles. So, it's really not just about needles. It's kind of very well rounded in the approach I use.
Yeah, I mean, I think that's really amazing. I feel like in the Western kind of world, like our experience with needles is like a hypodermic syringe, which is like what we give like shots with. And that's what we know. And of course, it's terrifying to think about like a million of those stuck in you because they're big needles. They're pushing fluid into you, which is actually quite painful in some instances because it's distending the tissue. But, my experience with Chinese medicine was kind of like, and I didn't obviously have the silicone coated because I'm an adult, but, when I did the needles, it was almost like, what? Oh, are you done? I was like, is that it? Okay, cool. Do the other ones now. It was like the first one. And then I was like, cool. I'm also super stoked that you're using other techniques, especially meditation, because that's a question that I get all the time. Like, will my kid meditate? And I think that that is also, it's because our experience is like, okay, your child's going to sit like, cross legged for an hour. And in quiet, and do nothing. And like in general, when I do meditation with kids, it is not that at all. I'm curious, like in your practice, like what kind of techniques do you use with meditation and kids? Is it guided? Do you do walking? Do you do games? Sometimes I'll do like kind of outdoor play stuff. Like what kind of stuff do you do with that?
Yeah, so I do a lot with breath work actually, especially when they're on the table and they're relaxed. I will put my hand on their belly, I'll have them put their hand on their belly, and we do a lot of kind of like tuning into the breath. We also talk about that meditation doesn't have to be this in a perfect box lying down. It could be having time to yourself and coloring. It could be having time to yourself and journaling. It could be playing outside, but really trying to focus on connecting, like connecting to what you're doing and connecting to yourself.
Hmm.
I cannot really sit and do meditation with the cross leg and what we picture as meditation. That does not work for me. So, what I
Yeah.
have learned over time is that it doesn't have to be this perfect kind of thing. It can be all the things. It depends on what works best for you.
I love the coloring. That's something that I do with the kids a lot too, especially kids that aren't yet able to read and write. Coloring journals are so great because, especially if a kid is trying to express something to a parent and they're not quite sure how to express what they feel, you can literally just give them a box of crayons and say, well, just color me a picture of what's going on inside and see what comes out. You may be really surprised. And they may be even able to tell you about it once they've drawn it out, which is amazing. Same with like walking in nature. I think sometimes if you just go for a walk, kids will just tell you stuff and you're like, whoa, I had no idea that was going to come out. And it's such a good way to connect and also connect with spirit too. On that, so I know that there can be a lot of concern around some of the different traditions like acupuncture and yoga and things like that, that there may be like a religious overtone or like suddenly, they're going to be indoctrinated into Buddhism or something. Like what has been your experience with that?
Yeah. So, I mean, the philosophy of Chinese medicine does have its roots in Taoism, which really, in its nature, is being open and accepting and inclusive of all religions. So, it really doesn't push an ideology in my experience.
Okay, so no one's gonna come and have their child, like, converted.
Absolutely not.
Okay,
Um,
perfect.
I will say the practice of acupuncture and like herbal medicine is not religious at all. It is, you are simply taking a system and treating something.
Yeah,
So
yeah,
similar to, having rotator cuff surgery, that doesn't have a religious like correlation.
yeah.
So there are, the philosophy is there, but it's very accepting and there's no pushing of anything.
Okay. Okay, perfect. Hey guys, it's Dr. Ellie here. I'm just hopping in on my pod to let you know that if you're a new parent or you're pregnant, you do not need to feel overwhelmed anymore about feeding your baby. If you're worried about like formula or breastfeeding or even starting solids, how to introduce allergens correctly, you're definitely not alone. If you don't know me, I'm Dr. Ellie, a holistic pediatrician here in Asheville, and I'm founder of Middle Path Integrative Pediatrics. I created this course, Nourish with Confidence, because of parents like you. It's super simple, it's self paced, it's easy to follow for busy parents who want a trustworthy, holistic, evidence based guidance or guide on how to feed their baby. So you're going to learn everything from choosing the best formula when breastfeeding is not an option, how to breastfeed if you're able to, and also how to introduce solid food safely and to avoid hidden toxins, how to set up your baby's gut health so that they can be healthy for the rest of their life. And so it comes with a lot of stuff, video modules, transcripts, references, PDFs, and quizzes. And of course, I'm always here in Asheville if you want to become a member too to get all your questions answered. So as one parent said, Dr. Ellie, kind words in the third person, is incredibly knowledgeable and caring. She gave me peace of mind when I needed it most. So I recommend signing up. So go to my website, middlepathintegrativepediatrics.com/courses to enroll again today. Again, middlepathintegrativepediatrics.com/courses to enroll today. And this is because nourishing your baby shouldn't feel confusing. It should feel confident. All right. So wishing you well from Dr. Ellie. So like when would a kid come for pediatric acupuncture? Like what things do you treat? Like is it just injuries? Is it digestive? Like tell me all the stuff that I can refer to you for.
It's all the things, really. It depends what's going on. I will say kids under 10, the number one thing is constipation. Like
Oh my goodness, yeah.
hands down constipation, and digestive issues. That is always a big one. Absolutely stress and anxiety when we get into teens, anxiety, depression, hormonal imbalances for sure. But we also address things in babies like colic, recurrent ear infections, recurrent colds and flus, failure to thrive. It really expands very broad in that sense. We can do a lot of things with Chinese medicine and acupuncture.
Oh, so that's amazing. So people can actually even bring their infants to you, like if they're not feeding well, or maybe they're like spitting up a lot and having reflux and things like that. That's so good. Okay. Yep. We're definitely sending people your way. Parents, listen up because this is a good one. Okay. So, like, what about results? So, okay, can you come just one time? Like, will you be fixed?
No.
Or do you need to come a few times? Okay. Yeah.
Yes. Yes. It is not a one and done medicine. What I tell people is first of all, you have to be open and you have to be willing to go on the journey.
Yeah.
And it takes patience and time because healing isn't linear, right? It is very up and down. So results really are based upon the condition and the child, because we're all different and we all respond very differently at our own pace. But I will say, like, in general, you have to come multiple times to start seeing results. But what we work with is really trying to change a pattern that's been going on for a long time and to get that new pattern to stick. And in order to do that, it takes a series of treatments, meaning 1 to 2 times a week over multiple weeks. It does depend on how long something has been going on. So, for example, if something's been going on for a year or more, I usually start out with 12 treatments at least 1 time a week. We make a lot of really good progress in those 12 treatments. Some people They might be completely great in 8 treatments. Some people might take a little more than that. It depends. But it is a commitment and it is all about consistency, really.
Yeah, I think it's so good to know because, like, this happens to me with when patients are coming for functional medicine. It's like the hope, which I completely get, is like you're gonna come to the one appointment and you're gonna leave with like a plan, and here's your like one supplement that you can take, and now you're gonna be cured.
Right.
And it's just doesn't really work that way, especially, like you to your point, when things have been going on for years and years, because let me tell you, and I've been there, humans have a really good way of ignoring things. And then you think back and you're like, well, how long has this been going on? And you're like, huh, it's actually been 20 years that I've had these symptoms. And y'all, it just takes a little bit longer to unravel those things in functional medicine. I know you're saying kind of the same for acupuncture too. So just be prepared for a little bit of a process, like most therapies and things like that. They just take time to work. Okay, so I want to talk more about your post grad work. So, pediatrics, gynecology, gastroenterology. I mean, I don't know if you can get more quick qualifications at this point. That's a lot. How do all those specialties show up, like in a way that support kids and families? Like, how do you use all this stuff? Because that is so much expertise wrapped up in one human.
It's a lot. I went into gynecology and gastroenterology because of the things I had dealt with. So I was 100% curious on learning more about those conditions so that I can help people given my experience with those. Pediatrics, I will have to say, in Chinese medicine, it is very much a specialty. It is a completely different animal. You really do need that training, in my opinion, to really make a big impact on what is going on with the child in addition to their family. And I'll give you an example why the training in pediatrics is so important. Kids do not form all of the acupuncture points that adults have until around age 7. In a
Interesting.
Right. So
Okay.
if you treat a kid like you would an adult, you're probably not going to have as big of an impact because you're going to use points that haven't developed yet. In addition to that, their digestive systems aren't fully formed either until around the age of 7.
Mhm.
So, if you were to prescribe some diet and lifestyle things for someone who's not quite yet 7, it may or may not be as effective because of their digestive system still being very immature.
Okay.
On the flip side of that, kids their energy runs along the surface of the body as opposed to adults, where our energy is much deeper because we've lived life and we've developed all these layers to us. So it is much easier to tap into a child's energy. They need very few tools, very few needles. I'm talking one or two. For some kids, like an infant, the needle is in and out, it's not retained. These are all things that are very different in comparison from pediatrics to adults. You can also overtreat kids. Sometimes, and this has totally happened to me in my training, I want to do more to help and I will move too much energy and then the kid is bouncing off the walls because I've moved way too much energy for them.
You're like, "Okay, lesson learned in my training program."
100%. So less is really more when it comes to kids, and if you don't really have that training, those are things that I never knew before I learned how to treat kids. So it is really a specialty, and it's something that you don't get in your normal acupuncture school. It is something that you have to get training outside of.
Yeah, and you were mentored as well for, like, was it a full year
It
that you
was
did that?
almost 3
Or was
years.
it was 3 years,
Yeah.
okay, so yeah, so it's like a residency. So if y'all don't know, after you go to medical school, you get a residency if you become a doctor in your specialty, and mine was pediatrics, and I did 3 years in that, so very similar idea. And I completely agree with the changing physiology that, I think this mirrors what you're saying in your type of medicine to my type of medicine. The changing physiology in babies to, think about even just teenagers. I'm not even talking age 21. It's daily. I mean, you take like what's going on in an infant's digestive system to what's going on in a teenager's digestive system alone. I mean, we've got different microbiomes, we've got different amount of enzymes happening, have our orientation of our stomach is a little bit different. We have valves that are working better as adults, so this kind of changing physiology, if you do not have a deep training in, it is very difficult to fully take care of issues on, a deeper level or on a level that really gets to the root cause, in my opinion. And it sounds like you've had that same experience.
Yeah, absolutely.
So, okay, I want to jump into misconceptions. I think the needles was a big one, but any other like myths, misconceptions, stuff that you just wish like every parent knew better before bringing their kid to acupuncture or considering Chinese medicine?
Yeah, so obviously the needles. I have had concerns with parents that if the child doesn't do the needles, they won't get results. And that is 100% not true. Again, I don't always have to use needles, and we can get really substantial, sustained results by using some of the other non needle techniques that I've mentioned.
So we don't have to do needles. And like, okay, I want to actually let's get a little more granular and let's put a finer point on this because I think this is really important. And I didn't go deeper. So, and I know, and I kind of glossed over it because I know what some of these techniques are, but I'm guessing a lot of people aren't familiar. Okay, like explain like what is a non-needle technique where you can do acupuncture without a needle or like cupping, like what is that? The moxibustion, like all of that. Do you mind just kind of breaking that down for us a little bit more?
Sure. For example, the laser pens, they literally look like ink pens and they come in different colors, and you put those on acupuncture points. And so the color of the pen is changing the energy in that point just as a needle would. It's
That's
just
so cool.
it's just a different approach of treating the point. In addition, I have this little device that kind of activates acupuncture points as well. It kind of puts like electricity, I would say, which may not sound great to people, into the acupuncture point, and it's just a vibration. So it's another way of treating the points without putting a needle in. You can also do acupressure. We have stickers here that have little seeds on them. I also use magnets, which is more of a Japanese kind of technique, but I also use magnets on acupuncture points as well to change energy. So it's really helpful to have extra tools in your toolbox like that. In addition, cupping. So adults are pretty familiar with cupping, the fire cupping with the glass cups. We use the fire, and we've seen athletes have these like circular cup marks on their backs. We do use cupping with kids, but they're the little suction cups. Those big glass cups that we use for adults are way too strong with kids. So it's really it's like a face suction cup.
Oh,
And
okay.
and we use those on kids. Again, being careful not to move too much energy with those. And then moxibustion. So moxibustion is very common in our practice. It is the process of burning an herb. The herb is mugwort. So we use mugwort a lot in Chinese medicine, externally and internally. And it comes in different forms. It comes loose. It also comes in this like big long stick that's kind of like rolled up. And so what we do is we light that, and it's really the warmth and the heat from the herb that we use to like enhance what we're doing. So we would use that also on acupuncture points to treat a point. We can move energy, we can what we call tonify a point, which kind of gives it a big hug and love is how I like to describe it. So we have all these different things that I can use on acupuncture points and like cupping to move energy without actually doing a needle.
That's amazing. I just want to come in for my own self and give my points a big hug. And I think this is great too for like any parent. Like if you're super needle phobic, sounds like you can do these techniques for them too, and they don't have to get needles either,
No.
which is amazing. Okay, good. Okay. All right. Well, Dr. Jen, I have been so I have learned so much from you. I'm so excited that we did this. For all the parents in the Asheville area, in and around Buncombe County, people who want to drive to see you, all of that, where can people find you? How can they learn more about you?
Yeah, so my office is located in the Five Points Montfort neighborhood. And if you live close to the Greenway, you can actually walk to our office or ride your bikes. Kids love doing that, which is super fun. And what we do is we require everyone to do a 30-minute free phone consultation. And that is by design, of course, because we want to answer all your questions. We want to listen to your concerns, and we really want to make sure we're a right fit for you. We really get into expectations, what the commitment looks like. We really want you to be set up really well before you come in. So you know what to expect, you know what the process is. And so it's a great way, even if you don't end up coming in and being a patient, it's a really good way to discover if this is right for your child and your family.
Yeah, it's so important in my experience to do those meet and greets. I do them too. Same reason is, not everyone is a good fit for functional medicine and not everyone should join the practice. And I want to make sure that, people that are spending their hard earned money are getting results. And so if they are going to come, that, it's the right technique for their child or for them at that specific time. And it sounds like you're kind of the same mindset like, hey, let's get you in and get you results. But if it's not a good fit, let's get you referred to someone who it is.
Absolutely.
So I've been by your office. It's super cute. You weren't there because I happen to live by there, but I walked by and I kind of peered in. So everyone should go there. What is the name of your practice? What is your website? What is the best way to contact you?
Yeah, so the name is Sacred Lines Family Acupuncture. Our website is sacredlinesavl.com, and you can send us a email, you can send us a text, you can make a phone call, or you can go online and schedule that free phone consultation. Our phone number is 828-222-0233. So we have lots of different ways you can contact us.
Amazing. Well, everybody reach out. I will tell you guys, Dr. Jen is super cool. She's super well trained. She's amazing. You're going to love taking your kids to her. So just go reach out to her. Don't even think about it. If you are thinking about it, just go to her website and sign up for the meet and greet. We will link it in the show notes. And thank you so much for joining me today. I know you're busy. I know this is time out of your schedule, but thanks for educating us, Dr. Jen.
Thank you.
So, bye everyone. I'm wishing you well. And again, if you don't know me, I'm Dr. Ellie at Middle Path Integrative Pediatrics. I'm on Hendersonville Road, and I see kids 0 to 21 for holistic pediatrics or functional medicine 2 to 102. And I'll see you guys next time. Bye.